Stress acne, like I said, is associated with increased circulation of androgens, cortisol, and you know, your you will perceive the severity to be more, obviously, and it will correlate with periods of stress. And the location I've already mentioned, it occurs in your forehead, your nose, your cheeks, your chin. And when you're stressed, you're also, you can also tend to focus on one particular area of your skin's health. So you can tend to pick at your acne more. So a lot of excoriation marks can be there, a lot of, post-inflammatory hyperpigmentation can be there. Sometimes the post-inflammatory hyperpigmentation and scarring is out of proportion to the severity of the acne itself. So how can we handle stress acne? First is, of course, reduce your stress levels. Second, if the acne is flaring to a degree that you're not able to, handle it with your own already existing anti-acne regimen, go see a dermatologist. Tell your dermatologist how you feel, tell them how this acne is affecting your confidence, tell them that you were stressed and it's causing probably a flare in your acne, and explain to a dermatologist. Hi, I'm Dr. Santhoshi. I'm a consultant dermatologist and I practice in Aesthetica Veda Whitefield Bengaluru. Now, stress acne. How is stress acne different from other kinds of acne? Stress acne, like I said, is associated with increased circulation of androgens, cortisol, and you will perceive the severity to be more, obviously, and it will correlate with periods of stress. And the location I've already mentioned, it occurs in your forehead, your nose, your cheeks, your chin. And when you're stressed, you're also, you can also tend to focus on one particular area of your skin's health. So for example, you're staring at yourself in the mirror and you're looking at, I'm stressed already and now look, my skin is also acting up. So you can tend to pick at your acne more. So a lot of excoriation marks can be there, a lot of, post-inflammatory hyperpigmentation can be there. Sometimes the post-inflammatory hyperpigmentation and scarring is out of proportion to the severity of the acne itself. So these are probably little, clues that point out that the disease itself is kind of, exacerbating secondary to stress. And how can we manage stress acne? First thing, like I said, awareness that you're stressed and taking concrete steps to manage stress. Now, if I say do not get stressed, don't take tension, that is a very hollow thing to say because it's not possible, right? So we need to understand that there's going to be moments in our life where stress is to the supreme, So what can we do? We need to have preventative measures in place that we can fall back on when life doesn't go too well for us. All right. So we do not have to wait for us to become overwhelmed by stress, drowning in our own sorrows, and then kind of try and crawl our way out. Okay. It's easier to have measures in place, okay, that we practice on an everyday, day-to-day basis so that when life is not too kind to us at that point, it's easier for us to resort to our, armamentarium, to turn back to our armamentarium and pull out the weapons that can help handle the situation better. So how can we handle stress acne? First is, of course, reduce your stress levels. Second, if the acne is flaring to a degree that you're not able to, handle it with your own already existing anti-acne regimen, go see a dermatologist. Tell your dermatologist how you feel, tell them how this acne is affecting your confidence, tell them that you were stressed and it's causing probably a flare in your acne, and explain to a dermatologist. And we dermatologists, we can of course always question about the role of stress by asking the patient, recently have you suffered from any kind of stress, be it physical or mental, and be kind, spend a little extra time with the patient, let them talk, let them vent their feelings out. That's very cathartic. And give them a simple regime that they can incorporate in their busy lives. So if they're stressed because their life is too busy, do not give them a regime that involves 10 different steps, okay, and promise them something as hollow as a Korean glass skin. We Indians for that, that Korean glass thing, skin thing is a fad because Koreans have those kind of genes, East Asians, they have those kind of genes. For Indians, no matter if we follow 11 step, 12 step, 20, 100 steps, we may not get the same kind of skin because our genes are different. Okay, we are different, doesn't make us less beautiful, doesn't make them more beautiful, doesn't, it's not that, it's just different, okay? Difference between a fish and a bear, difference between, a tree and a house. So there are two different things entirely. You cannot compare one race of people with the other, right? So for that matter, give them an easy regime to follow that they can incorporate into their busy lives and make it sustainable for them to keep up that routine for a long term. It should be sustainable. Do not give extremely expensive products that the patient cannot afford. It should be economically feasible as far as time goes, and also the patient has to be adequately motivated. You give them 10 things and then you do not explain how the patient has to use them, then the patient is already stressed. So the last thing they're going to do is sit and try and find out how to, use all these products. The patient may not even use them. So make it conducive for the patient to incorporate this into their already existing routine, and just talk to the patient and be open to their feelings and expressions. So that's all that matters.